Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
I would like to, I'm waiting for our guest speaker, so I will remind everybody, oh, there, Davey. You have a phone. I don't want you to be searching the World Wide Web. I want you to turn it off and put it on silent, because today's topic is pretty important and you might actually learn something. So today we have Dr. Davey Kennedy from Australia, and I'm going to do a disclaimer right now. Dr. Davey is retired. He's not interested in going into practice or anything like that. He just wants to relax. But if you do have questions, just keep in mind he's just here for advisory. He's not actually has his doctor hat on. So come on up, Dr. Davey Kennedy, and let's let her rip.
Thanks, George. Right. All right. Now, for starters, I see that there's a pamphlet being put out on the tables there, and I want to say that I hugely respect everybody's point of view, and it's really good that we have free speech and that we can all have different points of view. But I reckon if that chap had a chance to hear what I had to say, he might not be so frightened or worried, and bless him. So yeah, I'm David Kennedy, and I've been a doctor in Australia for about the last 25 years, and before that I was an engineer. But so what I want to talk to you about today is not that I want to give you medical advice. I mean, I can tell you about my experience, but it's really just about my heart journey and maybe to help, if I can, people understand about viruses and what happened with the horrible COVID vaccine stuff and all of that. So let's have a look. First of all, I'd like to say I'm so grateful to have found and come along to the Expat Club here and also the Tuesday one, because you're such an incredible bunch of guys, and it's the reason why I decided to settle here in Pattaya rather than some other parts of Thailand that I find really beautiful, is because there's just such a fabulous community of people here, you know, husbands and wives and people, and it's just a great honour to be able to speak, because I've heard some fabulous talks here over the last 15 months. So I first came here for a talk in July last year, and anyway, I'm very honoured and grateful for a chance to perhaps share something. So I'm also a bit daunted because there's a story that goes, if you put a frog into a saucepan and you turn on the heat, that it doesn't jump out. And the French perhaps, and some of the Thais as well, would be very familiar with that. That's how you cook a frog. But you start with it alive. And so one thing that struck me from being here is how incredibly strong and independent you guys are. You're the guys who hop out before it gets too hot and you boil to death. So that's why you're all living here in Pattaya, rather than anywhere else or back in our countries where we came from, because you're strong and independent and you have hope for life, and also that you all believe in love, and that's why we're here in Pattaya, because even if you might deny it, I'm sure that it's a place where there's a lot of love. And the other thing I wanted to say was that it's also daunting because everybody I've spoken to here has an incredible journey to talk about, and I've heard some of them, and I bet that there's a whole bunch of other people who could give a talk. I really don't like public speaking, but I'm honoured to do it, and we've all been on our individual heroes' journeys, and they're all different, and we all have something that we could share, I'm sure, if we were brave enough. So have a go, you mug, as we say in Australia. So thank you. So this is my disclaimer. Now, first of all, the Thailand Medical Board take very poorly to people who come to Thailand, even if they are a doctor, if they're not fully registered with the Medical Council of Thailand. So it's a very complicated and involved process to do that, including having to be able to speak Thai and all that kind of stuff. And the thing is that even if, and I found this out by speaking to them, even if you do volunteer work here as a doctor, you need to be registered with the Medical Council of Thailand. And particularly if you try and do proper medical stuff here. So it's actually, it's a real risk. And if you do try and do medical work here as a doctor and you're not properly registered, then you risk being thrown in jail or deported and not allowed back in the country. So I'm happy to be retired here. And I also wanted to say that in my medical school and in the type of medicine that I've practiced, which is being in remote communities, being in a one doctor town that's 500 kilometres from the next town, and emergency departments, we don't really get drug companies coming around and trying to influence us and tell us what we should and shouldn't give, because it's not that kind of stuff. It's really about troubleshooting and diagnosis, and then passing people on to the right specialist. And even so in the country as well, the drug reps don't come. So I'm not the handmaiden of any drug company, and I wasn't influenced in medical school by any drug person or drug person giving me anything. So I know there's a lot of conspiracy stuff on the web that talks about that, and I respect that might be the case in some medical schools, but it definitely wasn't in my experience. And as well as that, I'm not a specialist virologist, so I really want to talk about the practical nuts and bolts type stuff of viruses, and then try and help apply that in a way that might be useful for you. So I'm not going to be able to talk to you about the fine details of that stuff. So I'm more of a gunslinger. So in other words, I worked in emergency departments, and the main role in emergency department is to make sure somebody's safe, whether they're safe and go home, or whether they're safe and get passed on to some specialist. And so really, why I liked it was because it was a bit like engineering. So that was why I did it. So I'm more of a gunslinger type. I wonder if that's going to work. Go away. I have to point over there, do I? Next, there we go. Yeah, so this is a slide. I just put back on a disclaimer. I know this one's to tell you. So the talk today, first of all, I'll tell you about my background and why it helped me to get to the place I was, understanding viruses, and also, if we have a chance, I'll talk to you a little bit about my experience with COVID, which was very kind of special and unique. That I had a great chance to experience it from a lot of different perspectives, and possibly give you some heart advice at the end that might help you. Let's try the next one. I'll see if I can do it. Oh, there we go. So, I'm Australian. I was born in the United States. My father was an Australian naval officer, so I was born while we were there. As a naval brat, I went to 10 schools and travelled the world, and it was tough in a lot of ways, but it was great in a lot of ways as well. And I finished school in Sydney, and the main thing, I wanted to go to medical school, but I didn't get the grade to get into medical school in Australia, and so I got encouraged into engineering, mechanical engineering. But the main reason why I wanted to go to university was the usual stuff, but also because I wanted, at that stage I was getting quite good at rowing, and I wanted to row for Australia. And that was, it seemed to be a great way to keep doing my rowing and get to the top in Australian rowing. And so, anyway, after 5 years, I finished my 4-year mechanical engineering degree. And the main job and I worked as an engineer for 10 years, but the main job I had was working for this American multinational company called Schlumberger, which are the brains of oil exploration. So Schlumberger are the people who help make the measurements about finding oil and getting oil out of the ground. And it was an incredible honour because they mostly employed first-class honours graduates from all over the world, and with another string to their bow, and put them all over the world. So I lived in Egypt for a couple of years, 2.5 years, and Syria and Pakistan and Papua New Guinea and remote places in Australia, and earned enough money that I could go back and study medicine as a retirement job. But as well as that, I mean, it's not the only thing in my life. So I got married towards the end of my engineering time, and I've got 2 beautiful kids. And they're the best thing I've done in my life. And I'm so blessed and lucky to have beautiful kids who are 23 and 25 now, but kept rowing and won World Masters Championships and kept doing sports. So I've been very blessed and lucky. Anyway, so I went to medical school and I finished in the year 2000. And initially I wanted to be a surgeon, but I decided I'd become an emergency doctor in the end. And I've had some incredible experiences. I was the doctor for the Warner Brothers Elvis movie that came out a couple of years ago. So I was on the set while all that was being made, and I got to know all the stars like Tom Hanks and so on, and the director, and stayed on as their family doctor for a while. But mostly emergency. And then gradually I got more involved in working in rural and remote medicine and working in little towns where they have trouble getting a doctor. And that was mostly because I really enjoyed troubleshooting and helping people to resolve complex things. Anyway, on to viruses. So the first thing I want to say is a virus is really small. So if you look on that picture there, you can see like this is a COVID one, an HIV one, and they're tiny compared to your average blood cell. So you can imagine all the blood cells flowing through your veins and arteries, and they're just tiny comparatively. Whereas bacteria are a lot bigger. So they're maybe 10 to 100 or 1,000 times as big as some of the viral particles. And that's really important for later on, because the way we treat viruses has to be completely different. So antibiotics can float around in your blood vessels and not go into your cells. And they are the things that kill bacteria. But antivirals have to work in a completely different way. So we'll talk a bit more about that. It's some sort of a lipid particle, I think. All right, so we live in a relationship with all kinds of little microorganisms. So there's bacteria, viruses, fungi, prions, and worms and crabs and all sorts of stuff. And we're outnumbered. So for every cell in our body, we've got more than one of these organisms that live with us in a healthy relationship. And they're essential for our life. So we wouldn't be able to absorb our food properly if we didn't have them in our gut. And the good ones in our body help to fight off bad bacteria and viruses coming in. And the good viruses in our body, some viruses even fight against bacteria, which is fabulous. So we live in this happy relationship, and it's really important to realize that viruses just aren't all these bad things. And I always wanted to put up a poo emoji on a screen, but the first book I read about this about 15, 20 years ago said that our poo was only about 10%, 20% food residue, and the rest of it was bacteria. And I've read more recently and revised that to it's actually mostly water. But other than that, if you just take the solids, then it's still about 60% microorganisms. Then that includes viruses and bacteria. And the proportion depends on whether you're sick or not. Like if you get a rotavirus infection, then you get about 1,000 times as many viral particles as you do normally. So how do they get in? They get in by our hands, putting food into our mouth, like you go to Terminal 21 and you put your hand on the travelator, and then you don't wash your hands before you eat, and you get a little bit in your mouth. And it might not be enough to cause to cause you to actually get an infection, depending on your individual stuff, but it might. They come through the air, and apparently that's the main way that COVID gets in. So it comes through the air and lands in your mouth and nose, and then gets in through the linings. But they can also get in through things like cracks in your heels, which is why it's good for us older blokes particularly that if you've got cracked heels, it's a real entry point for bacteria and viruses, and you can get infections from those. So it's really worth looking after your heels. And one really important thing that I'm sure a lot of you wonder about is, why do some of us get sick from particular viruses and then the person next to us, our partner or our friend, doesn't get sick at all? So there's a whole bunch of factors about that. One of them is how much of the particular thing we're exposed to, whether we get a big amount of hit of virus or bacteria or whatever it is, or not. It's to do a bit with our personal genetic vulnerability. Some of us have stronger immune systems. We look, and you know, our bodies age at different rates, or we're more vulnerable to certain things. But for example, we might have asthma or something like that, and then if you've got asthma, then it might be that a particular virus is more likely to make you sicker than if you don't. And ladies, here's another example. So the position of the urethra really impacts whether or not they get urinary tract infections. So ladies before menopause get urinary infections from sex, and generally, and some women just have to have sex once or twice and they get really sick, but other ones never get it, and it's partly to do with the position of the urethra, and that's just individual genetic differences. Another factor is whether or not we've been exposed to a particular virus or something like it, because we've got these memory cells in our body that remember. We might not have had that particular one, but they'll remember something like it, and so we might clear a virus when other people don't. And as well as that, things like having smoked might damage your lungs permanently, and so that makes you more vulnerable to getting a secondary chest infection from a cold or stuff like that, or having had certain illnesses or injury that make us, there's all sorts of things that can make us more vulnerable on an individual basis. And some people, like with COVID, some people got it and they had no idea. So the stats for COVID of how many people actually got infected, that I'll show you later, and how many people died, are probably a gross underrepresentation of how many people actually got it, because a lot of people got it and cleared it. Like, for example, I heard there was a talk here on dengue fever a while ago, and apparently 10% of people thought they'd had it, but the virologist who spoke about it said maybe 50 or 60% had and not realised it. And it's the same with hepatitis A. Most people have had it by the time they're 30 and they may not have even realised it. And the same with glandular fever and so on. So this is just a bit of a slide to show. So that red thing is a cell wall. And so this is what viruses do. They go inside a cell, they get invaginated, they go inside a cell, and then they hijack our intracellular machinery, all of the normal things inside your cell to make themselves replicate, and then the cell dies and all of these viral particles will go out from that dead cell into your tissue. And so that's what viruses do. They replicate and they grow in number. So one of the main jobs of antivirals is to stop the viruses doubling. I mean, it's not like we kill them, but the idea is to try and slow down the replication so our bodies can clear them, because really it's our bodies, the only thing that we have that can really get rid of viruses if they can. And then, so the viruses will have a distribution through our body, like hepatitis viruses, like going to the liver, and there are skin viruses that, like shingles, or the wart virus that just go to the skin, and there are certain viruses that just love certain, like there's a nocardia virus that just loves the heart. So there are different viruses that love different tissues. And anyway, so then the viruses have replicated, they go out, and then we share the viruses. So we pass them on. We pass them on by sneezing or coughing or kissing someone, or having sex, or the fecal-oral route, you know, about hand hygiene and all that kind of stuff. So that's how we share them. But coming back to a more practical thing, so how do we know that we've actually got an infection with something? And this is something that was worked out back by Galen in Greece before AD, that there are 5 cardinal signs of inflammation. So these are signs that you've got infection. You might have pain. You might have pain in your bones or joints. You might feel hot in a certain place, or you might just feel generally hot, and you might have a red area in a particular part of the body. You might have swelling of that part of the body, and you might have loss of function. So that could mean that we just generally feel really wiped out and tired, or it might mean that some part of the body doesn't work as well as it normally would. So what I'd like to do is to take you through a few, from a mechanical engineer's perspective, some nuts and bolts, different parts of the body, and explain why we get the symptoms, because this is something that really fascinated me to actually figure this out. So you might have seen these kind of diagrams, like the one, there's one for dengue and one for COVID, and you can see that both of these viruses could affect so many different tissues, but they might affect none, and both of them talk about the same kind of tissues. So the main thing to take away from this is that viruses will impact linings, and just because they do one lining in you doesn't mean that they'll do the same lining in another person, or that they'll only do one lining in another person. So, for example, I was working in an emergency department and during COVID, and I was the senior doctor, and there was about 30 doctors, and one of the middle-level doctors said to me, "We need to do a lumbar puncture on this lady because she's got a horrific headache." And a lumbar puncture is a procedure where we put a needle into the spine to get some fluid to see if they've got infection in their brain. And I said, "Oh, tell me the story," whatever. And I went and assessed this lady, and she clearly had a viral illness. And she could have had meningitis as well, but given that she had all of the other signs of virus from other irritated linings and the story about it, it meant that we could at least start with that as a diagnosis, and we saved her from the danger of having a lumbar puncture. Anyway, so different linings. So let's start with a simple one, so the mouth. So if you look at the picture on the very far left, that's what a classic viral throat looks like. So you get these little red lumps on the back wall of the throat, like that, and you don't see much else in a normal cold virus or flu virus like that, and there are more or less of them depending on how bad the virus is. This next picture, the one at the top is the tonsils. So the tonsils in that case are really swollen. They're not in this one. So that's tonsillitis. Tonsillitis can be from viruses, but it can also be from bacteria. And as one wise GP who wrote one of the textbooks on GP, one of the main textbooks on GP said, there we go. Any doctor who says looking at a throat that's definitely bacterial or viral is a fool. So it can be very difficult to tell which one's which. There's a picture there as well of herpes, and herpes can affect your tongue and your mouth, and it can be terrible. And then kids come in and they can't drink, and so they just need to be admitted, and they'll clear it, but they just can't drink and they could die. So we need to put in an IV line and give them fluid just to help them. But yeah, so herpes is usually okay, but the trouble is sometimes you get recurrent episodes, and what causes cancer is where you have inflammation that doesn't settle in the body. So anywhere in the body that you have chronic inflammation, the cells say, we don't like this, and so you can get cancer. So that's an example of a throat cancer, probably caused by, it could have been caused by something else, but that's one of the possible things, the long-term effects of a lining disease. The picture of the little kitty there with the lymph nodes is to show you that when you get this back of the throat irritation like here, then the lymph nodes that come up are the ones at the back of your neck here. So the ones that are here and they run up onto your skull there. But people come in and from those lymph nodes being swollen, because lymphocytes travel via the lymph node, and so they get swollen because the lymph nodes are fighting the infection, and because of that, the lymph nodes get swollen, and that can squash the muscles and the nerves and the blood vessels around there, and that's why people can often get a headache when they've got an upper respiratory tract, particularly a nasty upper respiratory tract infection. So it's really, really interesting for me, it was a really cool thing to realise this was the mechanism of that. And partly I realised that because I get this and my lymph nodes come up with that sort of thing as well. But yeah, so they're the ones at the back of the neck, that's the posterior cervical, whoops, let's go back. The posterior cervical lymph node chains, these ones at the back here, they just run in front of your trapezius, so they come up. This is an example of viruses irritating your skin. So you've got your wart virus, and your wart virus isn't just a benign thing. It can do all sorts of things, like it can be lead on to rectal cancer and that sort of stuff. There's now a vaccine that can really help with that. There's some vaccines that if it was me, if you asked me what my thought was, I wouldn't get any more of them. But that's one that's actually made a big difference, and particularly for ladies with cervical cancer. But anyway, we're just talking about the genital warts at this stage, and so that's passed on by having sex. Then that's a measles rash in the middle there. So, whoops, let's go back. Measles rash, and then there's a shingles rash. So the shingles rash is interesting because there's little viral particles alive in that rash. So anyway, so that's what can happen with the skin with viruses. And then I just want to talk a little bit about the heart. So every year in Australia there's this big famous race called the City to Surf, and people run from Sydney City out to the beach, and it's a 10K race, and every year or so somebody drops dead, and it's some person who was fit and healthy and young, and you wouldn't have thought that they'd drop dead, but often it's from something like that. Viruses can irritate the bag around your heart, and so people get the bag around the heart's called the pericardium, so they get pericarditis or swelling of the bag around the heart, or the muscle of the heart's myocarditis, and that means that the heart gets big and floppy and you can get heart failure, and either one of those can cause death. So if you're sick, the sensible thing is just to be really careful and not try to exercise too hard if you think you might, or your doctor thinks you might have a virus. The upper gut. So how do we know we've got a virus that's impacting our upper gut? We might have pain or cramps in our upper gut. We might just be really dry. We might be dehydrated because we just don't feel like eating or drinking, so we get really dry. We might not even have pain in our upper gut, or we might get reflux from it, or vomiting, and we might have other things as well. We might have terrible pain. We might get pancreatitis with it as well. One thing that's really important is that there are a lot of viruses that are associated with people getting type 1 diabetes. That's the diabetes people get when they're really relatively young, like kids get it. And it's related to about 4 or 5 different viruses now they've found out. So it doesn't necessarily help that much at this stage to know that, but in the future, knowing that as a start might help us to avoid that a bit. Hepatitis, that's the hepatitis virus. So there's A, B, C, D, E, F, G, all different types of hepatitis. And if a virus is impacting the linings of your liver, then your liver gets blocked up and you get yellow skin and eyes, and you can get a range of other symptoms as well. You feel sick and lousy and all that kind of thing. The vaccines have made a great difference for helping people with might have got hepatitis B otherwise. And hepatitis A, as I say, most of us have had that by the time we're 30, so, and might not have even realised it because the virus didn't have much impact on us. But the trouble is, if you've got a virus like hepatitis C or D or one of those other ones, that's chronically inflaming your liver because they don't go away by themselves, then you can end up getting cancer in your liver. So it's something to really be aware of if you've potentially got that. Now the midgut's another really interesting one. So typically we get a family come in with little Johnny, and he's got pain in his tummy, and that seems to be the main symptom that he's got, and that's the one that they're worried about because they're worried he's got appendicitis. But and so as a doctor out in the middle of nowhere, it's my job to decide, do I call the flying doctor plane to come in and save little Johnny to take him off for appendicectomy, or can we wait and see what's going on? And so the midgut, the only way we can know that a virus is impacting our midgut is because we get pain there and cramping. But it's up to the doctor to help to work out, is this a appendicitis or is it something else? So there are things that make them different from each other. And if it's irritation of the lymph nodes in the midgut, we call that mesenteric adenitis. Generally, people will have signs that they have other signs they've got a virus, like they might not have a sore throat, but if you look with a tongue depressor in the back of their throat, they're going to have those red swollen lymph nodes in the back of their throat like we saw, or they might be sneezing. That might be the only other sign that they've got a virus, and so on. So anyway, that's the midgut lymph nodes. And while we've got that lymph node slide up there, the upper gut has its own lymph nodes as well that you can feel. So sometimes people get sore just in their lower back here at the top there. And so if you have an upper gut virus, then this part of your back here, just at the bottom of your rib cage there, you can feel swollen little lumps there, and people think it's their kidneys, but if it's on the outside and you've got little swollen lumps, it's the lymph nodes. So the viral fighting cells travel via the lymph nodes get swollen and sore. And the lower gut, the lymph nodes for the lower gut, by the way, are behind your sacrum here. So they're at the back here, behind the bony bit here. And sometimes you might feel sore in your back there, and it's not actually your spine, it's a bit lower down. And you've got these lumpy things there as well. And so they're the lymph nodes for the lower gut. But like the midgut, the lower gut can give you pain or cramps. You might have diarrhea. It might be that you've got viral irritation of your bladder. So one of the classic things, ladies come into emergency department and say, I've got a urine infection, doctor. And they've got bladder irritation, but it's because the lining of anything can get irritated from a virus. So the lining of the bladder gets irritated. And yes, they need to pass urine more often, but if you kind of ask the questions more fully and explore, and if you do a dipstick test on their urine, it turns out that they don't have a bacterial urine infection, so you save them from having antibiotics. They've got a viral one. The other thing to say, things like the wart virus can lead on to rectal cancer, and viruses, and the lower gut's reaction to viruses like the colon and the rectum and stuff, reaction to viruses, the immune system reaction can cause us to get some terrible things like Crohn's disease, which means chronic inflammatory bowel disease. So that's really strongly now associated with some different viruses. So here's some other ones. I don't want to go on endlessly, but there are so many interesting ones. I think it's fascinating. So cervical, so the wart virus, the wart virus gets up here into the very bottom end of the uterus, and people call it the common cold of the vagina. So ladies get it, and most of them will clear it, but some of them will have this chronic inflammation of the lower part of the cervix or the lower part of the womb. And as we said before, when you've got chronic inflammation, you can end up getting cancer. And so this is one of the things where a vaccine has made a fabulous difference, because not only does it stop people getting genital warts, but it's really cutting down. It's made a massive difference already for cervical cancer. And I've got there the prostate as well, because one of the things that really fascinated me in medical school was that 98% of men die with prostate cancer. So we all, if you look at our prostate, like when we looked at the cadavers in medical school, then you can see there's a little bit of prostate cancer in lots of blokes. But the thing is that it's not a reason to panic, because for most people it's a slow growing thing and it's not a big deal. But the question is, and it's starting to be solved, is it related to viruses? And it probably is. It's probably the same nasty wart virus thing that's causing the cervical cancer to ladies, because it's a sexually transmitted thing, as is causing the irritation of the prostate, chronic irritation of the prostate and prostate cancer. So about joints. So people get sore joints with viruses sometimes. One of the things about joint arthritis or the inflammation of the joints from viruses is it's because the linings, the synovium around the joints is getting irritated. So if you've got sore joints, it's often because the cartilage is worn away because we're all getting older, and so they're just a bit of bone on bone and that sort of stuff. But when you've got sore joints from a virus, it's because the linings of the joints are irritated. So once again, it's the linings. So here's another few little things. Just the picture first. This is a really fascinating one. So mum and dad bring their kid into the emergency department, and either it's on tippy toes like that, or it's just lame, and there's nothing else obvious going on. They say, my kid can't walk. They got up this morning and they couldn't walk, and they're terrified by what's going on. And there's some viruses that just affect the calf muscles in kids, and we call this benign myositis of childhood. So it's one of those things that once you've seen it as a doctor, and you're more likely in emergency than other places, then you know what it is. So some viruses just attack the linings of the muscles in the calves, and then that causes the muscle breakdown in the calf. They can get kidney failure from it and stuff, but it'll settle by itself. That's why it's called benign myositis. So it's something that's a really interesting one, but different as well. So other things viruses can do: Guillain-Barré syndrome, where people get a paralysis, a permanent paralysis, which is terrible from having a terrible gastro infection. Sometimes that's caused by a virus. What else have we got? Psychiatric conditions. Definitely OCD is related to throat viruses and bacterial infections. And a lot of other psychiatric conditions. If you look at research papers, there's a lot of papers that say viruses can cause them as well. What else? Learning, emotion, thinking. A lot of people have brain fog after COVID. So a virus can get into your the viruses can cross the blood-brain barrier, or the cells that are responding to them cross that, and they can affect our thinking. So it's real, and it's a real unfortunate thing that you have a long-term effect from a virus that could be that. So that's the nuts and bolts. So viruses irritate your lining. So what should you do, having had this talk? And it might terrify you a little bit. I hope not. I mean, you're all strong guys. But the first thing is, if you're ever sick, you should have a doctor, and you should find a doctor here who you trust, who you believe in, and you should find them before you're sick. So if you don't have one, get one. So you really need one. And how would I tell a good doctor from a bad doctor? For me, a good doctor admits when they don't know stuff, and there's a bit of issue with losing face here. But if you don't know, it's just so important to say that you don't know, and just accept you can't know everything as a doctor, and particularly we don't know about health. So that's one of the things. If you ask your doctor, what should I do to be healthy? Doctor can't tell you, because we don't study health, we only study disease. And so anything that they've picked up about that is something gratuitous they picked up later. So it's not the place to go to ask about how to be healthy. It's more that a doctor can help you when you're sick. So a doctor says, I don't know. They'll send you on to a hospital or somewhere else. If they don't know, they'll send you on to a specialist, and they'll also make sure that you're going to come back if you're not right. And that's the main thing. So you really need to get a doctor. And also, you can start off with just having a simple throat infection, and then you could get something like a pneumonia from it. So it's up to the doctor to be aware that, or you get shingles and you get a bacterial skin infection secondary to that, or so on. So it's up to your doctor to be aware that these things flow on from having a virus. You can get a secondary thing, or you have other trouble. So that's something that a doctor should help you with. And I know there's been all this terrible stuff with COVID and what happened with that, but even so, and doctors just tried to be good during that time, and we were forced to get vaccinated, otherwise we couldn't work, and we were considered like they're going to strike us off in the medical board permanently. But that doesn't mean that we necessarily believe in the party lines and the politics and all that stuff. But you still need a doctor, because there's a saying in medicine, a doctor who has himself for a doctor has a fool for a doctor. So if that's the case, then what hope have the rest of us got? Well, I know you're strong, independent people who've come here to Pattaya, but you still need a doctor. And one of the things that a doctor can help you with is making a diagnosis. Viruses, there's millions of different viruses. The trouble is that a lot of them require a specific test that costs money. And you don't necessarily need to know, because for most viruses, they'll pass by themselves or just with symptom medicine. So it's not, the main thing is to know whether or not you've got something that might need other help or just need help with symptom medicines, or whether you need antibiotics or something else. But the main thing is that if you share your sickness then, and you share what's going on with a doctor properly, then you've got more chance. So the main treatment for viruses is symptom medicine. So somebody might, like viral gastroenteritis is one of the biggest killers of kids in the developing world. So that means that it's from the vomiting and diarrhea that they die. It's one of the main killers. There's a couple of main killers of kids. So it's just a virus. And if they had intravenous fluid, they would live. But it's just about, so it's about symptom medicines really, managing viruses. So pain medicine, you might need something to stop you vomiting. You might need some oxygen. If the lining of your lungs is irritated. If you've got swelling in something like your joints or your brain or somewhere else, you might need steroids, and so on. But the main thing is about symptom medicine. So yes, there are antivirals, but as we say, they're not the main or first line thing unless you're really sick. And now the other important takeaway, one of the other importance for me, is that all drugs are poisons with beneficial side effect. That vaccines or medicines that you might take, they all can help you, but they all can have terrible side effects. And if you have side effects, don't do nothing. Go back and see your doctor, because like it might be sexual dysfunction for some medicine, not viruses, but go and see your doctor and ask if there's something else they can suggest. And if they don't know, see if they'll send you to someone who might know. So antivirals, let's say antibiotics. So antibiotics, you can see back to this slide here with a viral particle and the red blood cell. So antibiotics are big things that go around in your blood vessels, and they attach to the bacteria, and then the lymphocytes clean them up that way. But antibiotics don't do anything at all to fix viruses, and that's partly because the viruses go inside your cells, like I showed you in that other picture there. So if you went inside the cell with just about any medicine, there's a huge chance of damaging your DNA and all the other special mechanisms inside your cell. So that's partly why we don't have many antivirals, and they can work sometimes, and sometimes they can help, but often they're not called for. And there's and so the body, it's our own immune system that clears most viruses, and really, there's some viruses that our bodies don't clear, like herpes or HIV or shingles, and we're working on that. So doctors are working on what can they do to help with that. And like with the wart virus, things like that, there might eventually be a safe vaccine for those things, but Hep C used to be thought to be incurable. You'd constantly have stuff, but the new antiviral medicines for Hep C mean that it's just gone from your system. And it's not that it kills the virus, because you can't kill a virus, it's not alive, but they just allow the immune system to finally get on top of it. So maybe that's what we'll eventually get to with HIV and other things like that. All right, let's a little bit about ivermectin. So that's always going to be something that people are going to wonder about. So ivermectin was originally developed to help with worm infections, which are another. So there's worms and crabs, there's bacteria, there's viruses, there's fungi and prions. So a different kind of thing. But like a lot of things, one medicine can end up being found to be good for other things. So it's not specifically an antibiotic, in case you're wondering, and it's not specifically an antiviral or an anti-cancer drug, but it looks really promising. And one of the things that I find really disturbing is, depending on what sort of web you're looking at, it's still painted as this terrible drug, even though it's been around for an extremely long time and it's been extremely safe. You can't trust Google. So, I really think that the COVID vaccine was, and especially the way it was introduced in Australia, was just a horrible thing. But there have been some vaccines that have made a difference to the world. The measles vaccine is the one, like looking on the World Health Organization, that saved the most lives. So we don't see terrible viruses anymore very much because of the vaccines, but smallpox is gone now, measles is going, cervical cancer is going, and already they've changed the screening for ladies for cervical cancer. You have to get a pap smear every 2 years, which is just a horrible thing to have to do as a doctor, but must be worse as a lady. And there's even new malaria vaccines around as well. I'm not saying they're good or not, and I think it's up to you to work out your individual vulnerability and talk about it with your doctor. With the COVID thing, look, at the time COVID started, I was working for a drug trial company, and I stopped that. But it really, it was shocking how quickly the COVID vaccine was introduced. Did it save lives? Possibly. Did it cause side effects? I can tell you, I saw a lot in the emergency departments of people who had them, and we were told to just jolly them along and tell them that, it's really nothing. And we were kind of encouraged not to report too much about them. And so, look, I don't know what to say except that I got vaccinated because if I didn't, you were treated like you were some kind of subhuman life form in Australia if you didn't get the vaccine. You couldn't work, you couldn't get any money, and you couldn't go to a restaurant, you couldn't even go to a shopping centre. It was terrible. So I got the vaccines, having worked in this drug company, and at the time I was working there, this drug trial company, we were testing a meningitis vaccine that had been around for 10 years. Two of them put together, the ACWY and the B one put together. They've both been around for 10 years and shown to be very safe. But they were still going to be testing this thing in phase 3 trials for another 5 years before they were going to let it loose on the public. That just didn't happen with the COVID one, and it got hijacked by governments and vested interests. So, like I said, doctors were just trying to do their best at the time, and that doesn't mean that they're all bad. This is from the Worldometer, the one on the far left. I got that the other day. So you can see they stopped recording data in about April this year. There were about 700 million confirmed cases of coronavirus that they recorded, and 7 million deaths. So that's about 1%. The really interesting thing about this stat is that probably the cases is a massive underestimation, because like we were saying before, you might just think you had a normal cold with COVID, or you might have no symptoms at all. So you can imagine that the number of cases that weren't reported that were like that, you'd have to multiply that by 5 or 10 probably. And the deaths, they were probably over-reported because hospitals had a vested interest in reporting people who had COVID, but they died because they had heart failure and diabetes as a COVID death. And yes, COVID may have been one of the factors, but it definitely wasn't the only factor. The person was unfortunately very sick anyway. So, we're just about up to the end. A couple of things. So remember, if you're sick, men are terrible at this, going to see a doctor when they're sick. They often put it off, and don't be like that. I mean, you're the guys, you're the strong, independent guys who came to Pattaya. Just get a doctor and make sure that you can trust them, that they say they don't know, they'll send you away, and that you go back to them. Even if you don't hear them say it, it's implied. They want you to come back if you're not right. And as I said before, doctors really, we really are trained very well in disease, but we're not trained in health or what's healthy. And as I said before, a doctor who treats himself has a fool for a patient. Like they say that about lawyers as well, but it's true. We all just have to have somebody else independent because we might overlook some important symptom. Okay. So that's just about all of my heart journey about viruses. So I just thought I'd, like the speaker last week, see if I could do a little song. No complaints, no regrets. I still believe in chasing dreams and placing bets. But I have learned that all you give is all you get. So give it all you've got. I had my share, I drank my fill. But even though I'm satisfied, I'm hungry still. To see what's down the road, beyond the hill, and do it all again. Do it all again. So here's to life, to every joy it brings. Yes, here's to life, to dreamers and their dreams. Funny how the time just flies, how love can go from warm hellos to sad goodbyes. Oh my God, it cut out. Missed the best part. But let's just say that's enough probably. You probably don't want to hear, but it gets better. That's a great song. All right, so thank you very much. That's about it, really. That's my talk.
Are you ready for some questions?
Sure.
All right, here we go.
Yes, I'd like to ask a question about dengue fever. About 40 years ago here in Bangkok, I had aches and pains. My mouth tasted like it was full of rusty nails, and I didn't know that was the classic symptoms of dengue fever. I finally, after a week, went down to the mission hospital. The American doctor told me I had dengue fever, gave me paracetamol. And I went home and went to bed, and a few days later, I was fine. Except he also warned me I may have, what's the word?
Hemorrhagic.
Anxiety
Yeah.
for a while. That was the understatement of the year. This is over the 4th of July. Exactly 1 year later, I woke up in the morning and I had rusty nails in my mouth. Exactly 1 year. Does that mean I had dengue, the same one, because I know there's 4 kinds, the same one or another one? But the only symptoms was the rusty nails.
That's a fabulous question. And it brings on to one thing that I didn't really cover. And we clear most viruses ourselves. So with the dengue, I'm not 100% sure, but I understand that we clear one strain, and then it's if you get a second strain of it that you're more likely to get the hemorrhagic type thing with it. So the rusty nails is irritation of the lining of your mouth. And the other thing I wanted to talk about, I met this lady who was a blood taking lady in the emergency department, and she was this big, very round, overweight lady, and suddenly she lost all this weight. And she looked fabulous, and she was so dynamic and full of energy and everything. And it turned out she'd had a virus that had taken away her sense of taste on her. And so she lost weight, and she was just so happy and everything. But then it came back, unfortunately. So her sense of taste came back, and she put back on the weight. But yeah, so it could have been another strain of it. I think if it had completely gone away for a period of time, unlikely, but that's just my cowboy opinion.
Very interesting, and I'm imagining that you really had a beautiful mix of your engineering background with medicine, and that probably really helped you a lot. What were some of the most, from your practice back in Australia, what was like the craziest, funniest thing you ever dealt with, and what was the most bizarre thing you ever dealt with? And how did your engineering skills kind of help you with that?
Oh, thank you. It's a lovely question. I don't know. I just sort of dealt with everything as it came, and yeah, there's some things that were pretty crazy. It's just such a privilege. It's such a great honour and privilege to be able to help people, and engineering was great. And working for that's like one of the #1 companies in the world, Schlumberger. That I'm so lucky, but helping people is just a next level amazing thing. It's just such a honour and a privilege. I think helping people in remote communities, in Australia, a lot of the doctors who are out in those communities are people who've come in from developing countries as doctors, and they can't get a proper qualification until they've worked in the country for a long period of time. So they might work for 10 years in small towns, and so those doctors often they're doing their best, but they don't necessarily get trained all that well, or they don't necessarily relate to the people. Like if they're from, some country like Bangladesh or something, the people don't relate. So people are often really grateful to have somebody who's been trained in Australia who might have been lucky enough to have better training. But I really loved helping Aboriginal communities. That picture down there in the helicopter, I was going out to do an island clinic for the day in the Torres Strait, which is the bit of water between Australia and New Guinea. That was a fabulous thing to get to do. I don't know, I don't want to talk about anything specific, but yeah.
I've got 2 questions. One is, I understand that 90% of the population over the age of 70 has the herpes virus. Is that correct?
I can't tell you an exact statistic. I know that a lot have and don't realise it, or they've had it and they've cleared it. Yes, a lot of people have had it and then they never get a second episode.
Right, and my second question is, I understand certain recent research has confirmed that a lot of the problems with the prostate is associated with calcium buildup in the actual tubing and the prostate and the bladder itself. Is that correct?
Well, I'm not 100% sure, but my gut instinct as a gunslinger cowboy doctor would be to say, yes, that could very well be the case, because when cells break down, there's calcium inside them, a lot more than there is in the blood, and that gets dumped into intracellular tissue, and it's not often well resorbed. So you can get calcium in all sorts of weird places if a tissue's been damaged. So I wouldn't be surprised.
Thank you. Thank you.
Okay, hang on there. I'll be over there in just a minute.
A great talk. Can you tell me something about Nacardia?
Not specifically. Or if somebody...
Is it a virus?
Yes, it is. Nocardia virus.
It is a virus.
Yeah, and it's something that generally a diagnosis is made by a cardiologist with a person who's very sick with heart failure or other cardiac issues. So it's not one we make in emergency department or anything. So
I got very swollen legs, and I was due to go back to Ireland, and I continued to fly to Ireland. When I got to Ireland, I collapsed, and I was taken to hospital. I spent 4 months in hospital, and they couldn't figure out what it was. They had to take blood samples and send them to a laboratory in France. Mm-hmm. And eventually they pinpointed it as being a thing called Nacardia. Yes. They asked me if I'd worked on a farm in Thailand or had I been in touch with cattle and that sort of thing. So it took them a long time to figure it out. But I'd never heard of it, and a lot of people don't even know what I'm talking about when I say that. So you have heard of it.
Yes, it's an uncommon one, but like if you think of linings getting irritated, the heart's just another one that unfortunately, and it's terrible. So sometimes we might get a young person come into emergency who's short of breath, and they hadn't noticed that they'd stopped exercising 5 years earlier, but they've got heart failure because their heart's big and floppy because it's been damaged when they got a virus some time before. But yeah, unfortunately, and as I was saying about testing for viruses, often you just wouldn't waste the money. So the idea of you do a test when it's going to potentially change management as a doctor. That's the theory. Martin would agree. So if it's not going to change how you manage something, then you don't do a test. And every single test, like to test for nocardia, they probably, maybe it's just in France, if you're in Ireland, where they have to send it to, or London, there'd be only certain labs, and each test for that might cost £10,000 or whatever it is, or might cost a lot of money. So they only do it if they really think it's going to change management. Well, that's good. Yeah.
Thank you for your talk. I will have a question because now we know many things we did not know 2 or 3 years ago. What we know now, the last what I have heard was in New York or New York City. All firemen and all policemen who were put out because they are vaccinated, they can come back. Did you hear about that?
No, but one of my best buddies in Australia is a firey from the Northern Territory, and because he wanted to respect his body autonomy, he didn't want to be told that he had to have a COVID vaccination, and he was shamed out of the fire service in the Northern Territory. It was just the most horrible thing, and he's somebody who'd been going to fires for saving lives for 20, 25 years. He was also one of the people who cut people out of the cars in horrible car accidents and all that sort of stuff. It's just so shameful and horrible. And I don't have anything else to say except that it just makes me really sad.
Okay, this is one example you told. But my question is what the whole surrounding is. Not only one person or one special point. I hear from the World Economic Forum people, the most rich men in the world, they look for pilots. They are unvaccinated because the vaccinated pilots they don't like to have. Did you hear about that? There are many, many things. They come out now.
I wouldn't be surprised if you're right, Ollie.
Okay.
I really wouldn't be surprised, but I think there's a lot of stuff now, like if you search on Google for stuff
Oh no,
about
never
vaccines,
Google.
I agree. But what I'm saying is that it's very hard for us to tell what is truth anymore. And that's why really you have to be unfortunately we can't just trust our local doctor. We have to have a relationship with our doctor where we do our best to think about it and do our best to make sure that our doctor is someone that we can trust as much as we can. And they're not perfect, they're humans. And like I got the COVID vaccine, I wouldn't never get another one. I wouldn't get a monkeypox vaccine or any of that stuff, but I had to work. And I was, at the time, having worked in a drug trial company, I knew this thing had been rushed to market, and also working in emergency, I saw how there were heaps of people got terrible side effects from it. But I was too, I just went, at first, I thought, well, look, I can't be earning no money. I was frightened to be earning no money, and also to become a pariah. And in Australia, it was just horrific what happened to people who weren't vaccinated. Some of my good friends were really strongly respected their body and didn't want somebody else to force them to get a vaccine. I don't know what else to say.
I'm retired long time ago, and I think it's a good reason to say I have to work. I have to be vaccinated. But if I want to go in a restaurant or in a movie, I don't put something in my body what nobody knows. And that's what we have now. Okay, thank you.
I agree, Uli. That's not medical advice, that's advice from my heart. I agree.
I grew up with someone who had a problem with bleeding ulcers. And of course, the treatment at that point was simply just diet and he just bed rest and
That's right.
he pretty much couldn't eat hardly anything, it seemed like. So it wasn't until years later they discovered that that was from a virus.
That's from Helicobacter, which is this spiral bacteria that loves being in the stomach, and that can cause cancer as well. That's not the bacteria, but yes, similar.
Right.
Yes.
So it's a nice success story that that used to be a huge problem. Now it's almost gone.
Yeah, and that bacteria is a very weird one. What sort of bacteria would love to live in the most acidic of acidic places? And just amazing how some of our things that live with us, some of our microorganisms live in those crazy places.
Thank you, Davey, for your talk. I love having you around because you talk the language that we understand. There's absolutely nothing superior about your attitude at all, which is really excellent. I love it. I also like to listen to people who say, well, I don't really know the answer to that. Go and find somebody else, because you talk about engineering being your origins. Mine was the same, mechanical engineer. You learn, your senses just grow when you're a maintenance engineer. You listen to things, you smell, you touch, you feel, and it does help you in anything that you do later on. Because
it gives you courage to try and figure out things that you wouldn't figure out normally. Yeah, like Daryl over there does, or lots of people have done. Yeah. Especially because Schlumberger, we'd be out in an oil rig in the middle of the ocean, and just with a sideband radio that didn't work when it was cloudy, and you've got to figure out all these multi-million-dollar tools. What's wrong with them? Why is it not working? And it's a real gift to have had a chance to do that.
And it's such a good basis to start your career, whatever it is. I mean, I went into something very different, and obviously you did too. But I've always looked back and thought, wow, that taught me a lot.
What did you go on and do?
Electrical work and electronics eventually, and had a fabulous, rich career in electronics. You know, I made a lot of money, but I look back on that mechanical engineering as what taught me to actually be aware of things around me.
It's like a meditation, kind of.
I'd like to thank everybody for doing the survey today, but I'm apologize for not adding on the survey bacterial and virus-free in the questions. The other thing which I do have a question for you. Many years ago, my sister-in-law, God rest her soul, she died of breast cancer in 2018, was a health fanatic. I always remember going around to her place, pizza night, which was great. She sat down, had her pizza, I sat down, had mine, and my butt got a plate full of pills, vitamin pills. So the question is that going to help with bacterial or viruses? Thank you.
That's a great question, and once again, I'm going to say that I'm not 100% sure. I don't know for sure, but if you eat what I wonder is if you eat a really healthy diet, if you try not to eat too much processed food, or have too many other poisons like too much alcohol, that probably you would think that we would be getting, because we've come through millennia as humans, you'd think that probably would be okay. But definitely some people do have deficiencies of certain vitamins, because like some people just don't have the right equipment in their stomach to absorb a certain virus, or there's equipment in the last part of their small intestine that absorbs another type of thing, or so look, I don't know for sure, but I sometimes take vitamins, but I'm not sure they do anything, but I don't take my advice on that. You have to work it out for yourself.
Over here.
Davey, thank you for your presentation. It was excellent. Your singing skills. But
You didn't get to the good part of the song. I think he cut me off.
But I really liked your presentation. Great job. Hey, just for the sake of the audience, can you talk a little bit about oral health and bacteria and how that could affect your body and how smart it is to take care of your mouth?
I'm not sure how to answer that. I mean, yeah, I agree, but as I say, doctors really, we more specialise in illness and disease rather than health. But I can tell you, I've been reading this read this fascinating book about mouths and noses, and I think the more we breathe through our nose, the better off we are. And if we breathe through our mouths, it probably changes our bacteria that are in our mouths a lot more. So I started using a little bit of tape on my mouth at night so that I breathe more through my nose, and that helped reduce snoring. And when we had the talk by the urologist at the other club the other week, I was going to ask about that, because this book talked about how if you breathe through your nose, then you get more antidiuretic hormone produced, so you need to go to the toilet less in the night. But as far as bacteria in the mouth, yeah, look, I've heard all sorts of interesting things, but I'm just not sure. I think it's so difficult for anybody, even if they've got a background in it, to assess the accuracy. But I've heard things like if you use mouthwash too much, it can affect your sexual function. But certainly the best thing is keeping your teeth, because you need to chew your food, because that's the first part of digesting your food. And if you lose your teeth, then it's really terrible. It's a terrible slippery slope, because then you don't digest, so you're more likely to get sick, and I don't know.
Thank you for your talk, Doctor. First of all, I'll say I've absolutely no attention for medical things. That's just me. We've all got an opinion. And I think it takes a lot of courage to get up there and make a speech. I think you did it very, very well. What I want to say is something today I've not seen before. Someone putting out a leaflet that's actually quite insulting to the guest. That should not be allowed here. And I would apologise for that if it was anything to do with me.
Look,
but it definitely shouldn't be allowed.
I take no offence, and I think it's really good that we can have free speech and that we can have robust disagreement. And
yes.
I mean, if I was a different person, it might have upset me, but it didn't. That person who wrote that out of fear, because they're really frightened. And they've got every reason to be frightened, because what's happened since 2020 has just been really scary and horrible. And medicine and doctors who generally are conservative and try to be good boys were hijacked by politicians and drug company stuff. So I think people have got every reason to be terrified, and also to be terrified. But the trouble is, you need a doctor. So that's at the bottom of the thing. But I completely respect that that's their opinion, and it doesn't bother me.
Yeah, I'm agreeing with that. But what I'm saying is I've not seen anyone put out a circular like that before, and it's not right for a guest. You or anybody other guest are putting the effort in to put your point of view, which you may agree or not agree. It's not correct to put out a circular contradicting the guest before he even starts. I've never seen it before in all my time at the club. This club, the other club, be I mentioned, I'm just saying it's wrong. The point, it may be right, but it's wrong to do that in that fashion. That is my point.
Okay.
Sorry, but that's my opinion on it.
Yeah, I respect that.
We can't keep our fingers on everything, but I agree with you. I'm going to close off the questions, but I want to thank you very much, Doctor, for coming today. I think everybody learned something.
Now.
Now
I'm a singer and an emoji collector.
I don't want to break your bubble, but when you started singing, Barry Upton was over there and Barry left. I didn't mean to tell you that, but everything else was really great. So, on behalf of the PCEC, I'd like to present you with a certificate of appreciation, and you're always welcome back. Great talk.
Yeah, you're welcome. That's right. I hope somebody found it useful.
All right. Thank you very much. Great job. Okay, now we're going to get ready for the special interest group.